group. And one more person to keep in mind here is Elon Musk, who obviously has the ear of Donald Trump. He's also been a huge supporter of these drugs. So for what it's worth, he is somebody who could also weigh in heavily on that debate.
Yeah, like I mentioned, a lot of Americans keeping an eye on this. I know you are as well, my friend Joe Khalil, live in our nation's capital tonight. Thank you. And my next guest can help us break down this debate even further. Joining us now, Dr. Sue Dakota, a triple board certified medical weight loss physician right here in New York. Doctor, welcome to the show.
Happy New Year.
Happy New Year. So first, should the government cover the cost of weight loss drugs, in your opinion?
I think they should cover some of it. But again, these drugs are very, very expensive, and we really could implode with the cost. My biggest concern with the use of these drugs is they're often not used properly. So what makes my practice different is that I follow every patient with a body composition scale. And what I'm doing is I'm tracking the amount of fat loss. That is key. Otherwise, patients will yo-yo. They'll lose weight, but it may not all be fat. And if it's not all fat, they're going to gain that weight back. They're going to get hungry again. And in that sense, the drug is not effective. Once we get that body fat down to a very lean level, even if the patient is old, we really see that these benefits are long lasting and we can get people off the drugs. So what I would say to Dr. Oz is if we cover this for everybody and ask the taxpayer to pay for it, patients are never going to be able to get off these drugs if they're not used properly. But if they are, they're a tremendous tool. And I'm talking about Ozempic, semaglutide, Tirzepatide, which is Mounjaro, Wegovy, and the new drug Decotiis.
You say that weight loss does not have a one-size-fits-all solution. That what works for one doesn't work for another. That makes complete sense. But RFK Jr. argues people just need more discipline. They need a healthier lifestyle. It will eliminate obesity altogether. Could lifestyle changes be enough?
Well, in my practice, I see thousands of patients a year. Many patients already have a good lifestyle. They've done the keto diet, the paleo diet. They may not be morbidly obese, but especially as they get older with hormonal changes, they see a change in their body and they don't feel good and they don't get the workout that they used to get at the gym. So when they go to the gym and they don't see the results anymore, and then they start getting hungrier. And the key here is insulin resistance. And that can be caused by genetic factors, by what we call epigenetic factors. The bottom line is that when you're insulin resistant, you can't burn fat. And this often happens as we get old. It is a function of age. So that's why as people get older, they tend to gain weight, men and women.
Doc,
it is multifactorial.
We just had a graphic up of the monthly prices of Ozempic and medications like that. Why is it so much more expensive in the United States compared to the UK, where you can get it for less than $100?
Well, it's not widely available in the UK. Realize that. Not all the drugs are available, and they're not widely available in France. Here, they're much more available, and we just have different laws. So the thing is, the pharmaceutical companies do have long patents on this. I think the patent for Ozempic doesn't expire for 15 years. I mean, it's going to be very difficult to revoke that patent and then turn around and expect the company to continue to do more research and make more drugs if they're going to be slammed because somebody wants it covered. So I don't know how well that's going to work. But it's not just, of course, we have to clean up the food. And the other thing that we have to think of is that so much in our environment, food and things we're exposed to are endocrine disruptors, and this can cause infertility. Just think of the money that we spend in the U.S. on infertility treatments, which is widely covered by insurance. Think about that.
Doctor, and please correct me if I'm wrong. So it seems like you believe both of them. You think the advice from both RFK and Dr. Oz is correct.
We have to clean up the food supply because even if someone isn't overweight, it's so toxic. It probably increases the chances of cancer, inflammation, arthritis, connective tissue diseases, the immune system. Because what we're working on when we lose weight, as I mentioned, is the fat. So the fat cell is very metabolically active, and it makes these things called cytokines. And many people that died of COVID had this problem where their cytokines are very overactive. So when we get rid of that fat cell population, and we have to do that with proper nutrition and adequate hydration when the patient's on these drugs, then we really get long-lasting health. And I think it's also an anti-aging treatment Because any time that you stabilize and potentiate the effect of a hormone such as insulin, you're really helping the patient to have a much longer health span, the years that he or she is healthy.
You and I were talking about
that saves money long term.
Absolutely.
Let's the cost of these drugs and forcing the companies to lower their prices and not make their money back. I don't think it's a smart move. And again, people have to take it properly. If these drugs are being thrown at people like water, and they're not actually losing the fat because they're not being followed, it's a huge waste of money. So that's what I would tell Dr. Oz.
You and I,
but they're remarkable drugs, and they really can generate your appetite regulatory system, so that when you're done and you've lost all this fat, you don't crave the foods that perhaps you used to. Everything changes.
Yeah, you and I were talking about the prices a second ago. Insurance companies are increasingly scaling back coverage of these drugs because they're so expensive. Is making drugs like Ozempic more readily available the answer? You already have insurance frustration and outrage. I hate to bring this up, but the killing of the United Healthcare CEO just a few weeks ago.
Mm-hmm. Yes, yes. So yeah, the cost is frustrating, but in my practice, for the most part, patients cover it themselves, and they really feel it's worthwhile. If they have to cut back on taking a vacation or buying an expensive handbag or whatever, they do it because they know what the long-term effects are going to be, and it's worth their while. And they wind up saving money on other medications that they don't have to take. A lot of people have gotten off Adderall, off Xanax. As I said, I've had many patients who become pregnant on this, and they never thought that they could. Wow. They feel so much better. They look younger. So the net effect is very, very positive. But once we have the government cover things, we have to be very, very careful because we could implode under the cost.
Such a fascinating conversation. All right. Thank you so much, Dr. Sue Dakota. We appreciate it.